I'm Richard Clarnett. I'm an orthopaedic surgeon of the hip and knee, working in Adelaide at Wakefield Orthopaedic Clinic and Royal Adelaide Hospital. If you've had a knee replacement, most people have that because of arthritis, and because of the arthritis you'll get stiffness, extra pieces of bone forming, and you'll lose movement. Usually you won't be able to straighten the knee fully. That's a loss of extension, and normally your flexion will be limited as well. We need to work very hard to get both extension, straightening, and bending, which is flexion. When you have a knee replacement, what we've basically done is resurface the end of the bones with a metal component to replace the end of the femur bone or the thigh bone, and a metal and polyethylene component to replace the top of the shin bone, the tibia, and a polyethylene resurfacing. But the knee bends in much the same way as your native knee. Getting the knee straight to 0 degrees or perfectly straight is very important after knee replacement surgery. If it doesn't straighten, it will have a couple of problems. You will always limp, and that is not ideal. We also need to get the knee bending. The more the knee bends, the better it will function. We need to really work to get that movement into the knee. The quicker we do it after the operation, the better the result, but it does require a lot of work and a little bit of discomfort. I'm going to show you some of the exercises that we use, and really the most important ones. It's mainly that perseverance with physio which will get you the good result that we're looking for. The exercises need to be done by the patient, by themselves, over the first few months. So we're going to look at Jill, who is 2 days after her knee replacement surgery. She's had a full knee replacement, sitting in a high chair so that her knee can hang. A bit of time with the knee hanging will be a good start to getting flexion. The next exercise, she is using her unaffected leg to push her knee replacement leg into flexion. So it was hanging at around 80 degrees, and with this passive flexion we can see that she's getting around 100 degrees of flexion. The next exercise, which is also passive flexion exercise, the right foot on the ground to steady the foot and then push herself forward on the chair, forcing the knee into around 100 degrees of flexion. The next exercise, notice when she tries to straighten the leg, it won't straighten because she's lacking muscle power. Now that happens in the first days to weeks after knee replacement, but that always returns and that doesn't concern us. Now notice when she's lying on the bed, the knee is sitting almost straight. We want the knee to come into complete extension. We need to put a roll towel, or at home you can put a small cushion under the heel to give space under the knee to allow the knee to go into full extension, because we need extension of 0 degrees. Now with the roll towel, gravity's helping to push down and she's getting a bit more extension, and then we're going to add 1.5 to 2 kilogram weight on top of the knee sitting there, which will help to get her into full extension. And she's just going to sit there for 20 minutes 3 times a day. A 2 kilogram bag of rice from the supermarket works just as well as the sandbag. So they're the key exercises she'll need to be doing to get the range of motion where we need it to be. Notice also that the wound is covered with a waterproof dressing, and the sutures underneath those dressings are very secure. Doing the exercises will not jeopardize the wound, and it won't jeopardize the knee replacement. The quadriceps mechanism is also completely resistant to these exercises. No damage will occur if you use some degree of a force to help the knee bend. In fact, it will be to your advantage.